Hello, welcome. This is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center and the owner of the Essential Health Medi Spa. And tonight I've got with me Dr. Kanwar. Is that how you say it?
Yes.
Okay, I did it right.
Got it right.
He is an infectious disease doctor. And so he's the one that we all go to when nobody can figure out what the heck is wrong with our patient. He's the one we go to. So he's got a pretty big job, but we're going to talk about that as we go on. So thank you so much for coming. It's great for you to take out your evening and away from your family to be with us.
Thank you for having me.
It's
a pleasure.
It's very good. So how long have you been here in town?
I've been in Rocky Mount since last 1 year.
Okay. All right. So you're getting acclimated a little bit. You live here?
No, I live in Zebulon.
Oh, okay.
Yeah.
Okay. Well, that's not too far away.
Yeah, 30 minutes.
Yeah, it's kind of that's a nice halfway between here and Raleigh.
Yeah.
So you can go either way. You can go to work, can go and have fun. So tell me a little bit about yourself. Were you raised in the States, or where were you raised?
Yeah, I was born in India. I spent, I would say, first 20 to 22 years of my life in India.
Mm-hmm.
And then I came to States to pursue my internal medicine residency, which I did at the University of Oklahoma. And then I did a fellowship in infectious disease at Case Western in Cleveland, Ohio, for 3 years. And then after that, I practiced in rural Washington and Pennsylvania, then came here.
Oh, wow. So from one end of the country to the other.
Yeah, I think kind of explored all of the U.S. and, I think found out that North Carolina weather is a great fit for me and my family.
Yeah.
So I love it here.
We have a little bit of winter, but you wouldn't know it by today. It was like 80 degrees. I'm like cooking.
Yeah, in November.
I know.
Unbelievable.
I know. So I guess we'll have to cook our turkeys for Thanksgiving on the grill. I don't know what's going to go on with this weather the way it is. But anyway, so what made you decide to be a doctor? Have you always wanted to be one? Your mama pushed you that way?
No, not really. Actually, in my family, I'm the first doctor.
Are you?
Yeah. And I was just fascinated by the novel profession, grew up seeing a family doctor come to my house. And I always had interest in biology. Mm-hmm. My mom is a school teacher, and I used to go with her to her school and found ways to go into biology classes and see people or students looking into microscopes. Those things fascinated me. Mm-hmm. And I just thought that it's also inherent to my nature to help each other, others.
Right.
So I chose to become a doctor.
Okay, all right. So you live in Zebulon. You're married. I think you said your family.
Yep.
So tell me about your family.
Yep. I have a wife. She's a mathematician.
Oh, she and I would not get along. I don't like math. I don't like numbers.
And I have 2 kids. My daughter is 7. My son is 4.
Okay.
Yeah.
So you're busy.
Yeah.
Yeah.
I have my hands full.
Does your wife work, or she stays at home? Staying at home with 2 children is a lot of work.
Yeah, I would say, but children go to preschool.
Oh, okay.
The younger one, and the daughter goes to school, and she teaches 4 days a week.
Okay, where does she teach?
At community college in Wake Tech. So Wake Tech Community College, Northern Campus. Okay,
that's a big school. It's spread out all over.
It is. It has like 5-6 campuses around the Raleigh area.
Yeah, I know. It's it's a lot bigger than Wesleyan University, where we're sitting right here. So it's kind of interesting. But yeah, that's good. Okay, so infectious disease. Why did you decide to go into that? Why did you want to be the end of the rainbow, so to speak? Nobody knows what to do. We come and ask you.
So infectious disease appealed me, I think, in India and developing countries. I would say infectious disease constitute the crux of, what people practice as medicine. And I was fascinated by the fact that infectious diseases are curable.
Yes.
Like 98%, of infections are curable.
Yes.
And that's huge, satisfying thing to me as a doctor. Plus, infections involve anywhere from brain, your head to toe. Mm-hmm. So it involves multiple systems. Mm-hmm. And another fascinating thing is that bacteria, viruses, all these pathogens, it's a lot of variety. So it keeps jobs challenging.
Sure does.
And it's so tied to public health.
Yes.
So, and I've seen that simple interventions like hand hygiene, vaccinations can have huge impact. So all those things fascinate me. So I, chose to become an infectious disease doctor.
That's awesome. So it's a 3-year fellowship?
It's a 2-year fellowship.
2-year?
Yeah.
Okay. Yeah, so that, yeah, it's a lot. I think it's a lot. So exactly what is infectious disease? Can you
Sure.
explain that?
I think we can, define infectious disease as diseases where an infection is attacking or affecting the human body. And we can involve any system from head to toe, from nervous system down to bones, down to heart, down to kidneys, down to our GI, the
Right.
intestines.
Yes.
So it encompasses a wide variety of diseases. Commonly, the infections which I treat are infections of the bone called osteomyelitis.
Yes.
Infections of skin, cellulitis, sepsis, COVID, pneumonia, meningitis.
Just highlighting something.
Yeah.
Yeah, you talked about virus, and it brought me back to when I worked in the emergency room years ago, long time ago. We had a nurse that she developed a virus, and it got into her brain.
Oh, wow.
She was a young woman. She was probably in her 30s. She had just completed her bachelor's degree and was getting ready to go to nurse anesthesia school.
Got
Yeah.
it.
And we don't know where she got that virus. And of course, now this was, I hate to age myself, but this was probably 20, 25 years ago. So
Got it.
they didn't have a lot going on at that time as far as knowing. I don't think we even had an infectious disease. And I know we didn't have one in town.
Got it.
And so she was treated by a neurologist, and he did everything under the sun. He contacted Duke, he contacted Chapel Hill, and nobody could really help, And I don't know, can you take care of a virus that's in the brain now, or just it's still fatal for the most part?
I think any infection which involves brain is serious.
Yes.
There's no doubt about it. There are infections, for example, herpes viruses.
Yes.
Herpes simplex 1
Yes.
and 2.
Yes.
Those we have medicines that we
Right.
can give to treat.
Right.
And if it is timely detected and treated, patients recover. Now, there are viruses, for example, West Nile. I'm sure has spread in the U.S. since 1990s after it came to New York with mosquitoes hiding in rubber tires,
Oh, jeez.
through a ship. And then it spread to birds, and the birds spread it all over the U.S.
course.
Now, it's very common. So that is not treatable. We don't have any antiviral medication to treat it. And there are a multitude of other viruses. I think the other thing also is the immune system. So, it's basically a fight between the virus and the immune system. Sometimes, if it's an aggressive virus, it can affect people with normal immune system, make them really sick. On the other hand, there are some weak viruses which can take advantage of weak immune system and cause bad infections.
Right, right. So let's just veer off just a minute. What would we need to do to increase our immune system? How do we stay
Really good
healthy?
question. I think we can increase or boost our immune system is one, maintaining our general health. So preventing diabetes,
Yes.
preventing obesity, practicing, healthy lifestyle, which includes exercise, but also intake of things such as fruits. Lately, we have known that both fruits and vegetables have compounds called flavonoids,
Yes, that's right.
terpenoids, polyphenols, and all of these things are instrumental in modulating our immune system. So those, there are supplements which people can take. There are things we call as adaptogens.
Yes.
For example, ashwagandha. It's a Sanskrit name, but it's common adaptogen which can decrease internal stress. Similarly, holy basil, that can be used as adaptogen. So there is a wide variety of herb supplements
right.
which taken under
Right.
the supervision of a practitioner
Right.
can be helpful.
And I use a lot of essential oils.
Yeah.
You said holy basil, and it's one of my favorites.
Yeah.
I like to diffuse it.
Yeah.
Yeah. So I'm glad that, I'm glad that medicine is kind of veering off to some of the more natural things too. I think it's important.
Yeah, I think that's the future of medicine.
Do you?
Yeah, integrating our traditional systems of medicine with the Western medicine.
Yes.
And, that's the
Yes.
medicine of the future.
Yes.
In fact, I want to share one personal anecdote. So
Yes,
when I was
absolutely.
small, my mom will give me 5 leaves of holy basil that I will take. And in my culture, that is one thing, which you can give to kids to boost their immune system. It's just 5 leaves.
I know,
It's
right?
not harmful. You can wash
How does
them.
it taste?
It tastes a little bitter, but you can mix it with honey,
Oh, of course.
and it's
Anything's better with
delicious.
honey on it. I like honey. I'm not big on sugar, but I do like honey. So, yeah, I, excuse me, I push eating healthy. You've got to cook. You cannot eat the processed foods. It's
Yes.
full of sugar, fat, and salt. It'll
Yes.
make you sick. It'll make you sick,
Yes.
seriously.
Yeah.
And I exercise every day, you just have to. Our bodies are made to move.
Yeah.
And lots of water, no alcohol, no smoking,
Yep.
all those things. And for the most part, that can help. Some people just have bad genes, I think, and
Yeah, I think that also predisposes you, but I think, most of the genes require a certain type of environment to be expressed
Yes.
to cause an effect. So if we give the right type of environment, we can prevent bad genes from causing their bad
Right.
effects.
yeah, awesome. All right, it's time for our first break. So when we come back, I haven't even touched my notes, and we're already third of the way through the show.
Time is
So-
flying.
Time flies when you have fun, that's right. All right, we'll be right back. Listen to our sponsors, and then we'll be back with Dr. Kanwar, and we're going to talk more about infectious disease, so don't go away. Hang on.
When Anita needed surgery, she struggled to find a doctor who made her feel at ease. Then she met Dr. Stephen Grant.
And his bedside manner and the way he treats his patients was fantastic. He was different from everybody else I'd ever seen. He's compassionate. He really cares about his patients. I told him, you were my guardian angel. My experience with Nash was A+. I said, any surgery I need here on out, give me a blank piece of paper, I'll sign it. I want you to do it.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't arise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
Make any day special by coming into Ribeye Steakhouse in Nashville. Come on in and enjoy our legendary tender and juicy Omaha Angus ribeyes. And try and share our seafood entrees, your choice of shrimp, flounder, or oysters. And especially don't forget our famous salad bar with all your favorite fixins. If you want to give that someone special something to revel in, Ribeye's gift certificates can be made to order. And as you're looking for somewhere to host a business meeting or a special event, you can reserve the Angus Room. Ribeye Steakhouse of Nashville, over 10 years of great food.
All right, welcome back. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and I'm the owner of the Essential Health Medi Spa. We have with us tonight Dr. Kanwar, who is an infectious disease physician, and we're going to learn all about infectious diseases. We've talked a little bit about how to keep our immune system up and keep us as healthy as possible, but we're going to move into some preventative medicine. We're going to talk about some immunizations. So let's talk about shingles. What is shingles and why does it hurt so bad?
Very good question. So shingles is a common term we use for an illness where a patient has rash, which involves blisters usually.
Yep.
It's painful or itchy, and it causes pain. And typically seen in patients which are more than 50 years old. And it basically involves reactivation of the chickenpox virus. So
if you've had chickenpox, you've got the virus, is that correct?
yes, so the virus does not die. It kind of lays
not.
dormant in your
Yes,
nerves.
yeah.
And when the immune system goes down, it wakes up and travels along that nerve to the skin and leads to these blisters. And that's very unique about shingles, is that it is a rash which is usually linear in a straight line, does not cross the midline.
That's right. That's right. If you've got a rash all over your tummy, it is not shingles. If
Unlikely.
you've got a rash on one side.
That's more likely.
Yeah.
Yeah. There are exceptions always,
Of
but
course.
yeah.
Of course. Yeah. So I guess the pain is because it's on a nerve path,
Yeah, so it involves the nerve endings, and that's why it's very painful.
and it really is.
It is.
Anybody out there that's had it or knows somebody that's had it, you know it. To me, the only thing that's worse than shingles is a kidney stone. They're pretty painful too.
Yeah. And the other thing is that not only it is painful while the patient is having that rash, it can lead to what we call as post-herpetic neuralgia,
Yes,
which is shooting, lancing pain, which can last for months to years after the shingles attack.
Yes, I had a lovely lady. She was elderly. She was in her 90s, and she developed post-herpetic neuralgia, and she would come in every week. Linda, do something for me. Help me so it won't hurt. Well, she's 95. She was over 90 years old, so I couldn't give her anything that was like, oxycodone or something like that.
Sure.
And even tramadol, I was pretty hesitant to give her, so I did, and I gave her a shot of Toradol, which helps some, but it's really, really painful.
It is.
And
It is.
the older you get, the harder it is.
Yeah.
So tell me about the immunization for shingles is called Shingrix. I guess that's the brand name.
And that's a vaccine which is highly effective. And I want to emphasize that, anyone above the age of 50, if you had chickenpox, you should get this vaccine. And the vaccine is, I would say, 90% effective. 90% effective.
That's pretty high.
Pretty high.
Yes.
Among many vaccines we see,
Yes.
90% effective in preventing shingles. And if you have shingles, and then you get this vaccine, then it might not prevent post-herpetic neuralgia. I think that's a very important distinction.
Oh.
So it's important to get it
Yes.
before you get shingles
Right.
to prevent post-herpetic neuralgia or other complications. The other thing with shingles is that normally it involves the skin over our body below neck, but in rare cases it would involve the nerves involving or providing the supply to our eyes and ears.
Yes, I've
and
seen it
that's
in
the
the eyes.
worst, because it can lead to vision loss, hearing loss, facial disfigurement, some serious complications.
Yes.
So I think people who have not received it and they are more than age 50, they should talk to their doctor, but definitely get this shingles shot.
Yep. Now, I know that you can go to the pharmacy and get like the flu vax and things like that. You don't need to have doctor's permission. Do you have to have it for the shingles?
No, I think
They
you
can
should.
still give it?
You should be able to get it at your
Yeah.
pharmacy.
Yeah.
If you are more than age 50. Now,
Right.
we do recommend shingles for certain immunocompromised patients who are
Mm-hmm.
younger than 50. And I think those are the ones where they need to get
Have
it.
the
Doctor recommended.
Yeah. So, and that's a series of 2, isn't it? You get
Two
about
shots.
6 months apart, is it 4 months?
Minimum 2 months. So first
months.
shot followed by second shot, which is 2 to 6 months. So
Okay,
anywhere
okay.
from 2 months to 6
6
months they can
months.
get it.
Okay, and then that's it, right? There's
That's
not,
it.
yeah. So let's talk about the flu, since it's, I don't know if it's gonna, if, I haven't seen too much flu, and with this warm weather, I don't know if we're going to, but, so the flu vax, how do they determine, the manufacturers who put out, because it's not the same strains all the time, is it?
No, it changes. So it's very interesting that how the manufacturing of flu vaccine happens. So there are, I would say, 129 countries which supply samples to 7 major centers designated by World Health Organization.
Really?
Yes.
Oh, I didn't know
so
that.
there is a year-round surveillance happening of flu, both animal and human, in 129 countries.
Wow.
So they are looking at what are the most common, prevalent human flu strains. And then they send these strains to these 7 centers. In the US, the most important is in CDC in Atlanta. And there's one at St. Jude's in Memphis, Tennessee,
Okay.
which monitors the swine flu or the animal flu. And then CDC determines that this is the most common strain, and they pick up 3 or 4, and then they work with the vaccine manufacturing companies to manufacture the vaccine.
So it's a kind of a, I guess, good way to do it, but it's kind of a shot in the dark too, isn't it?
Yeah, it's you cannot predict every viral strain 100%.
That's right.
So, but I think common strains are common, so
Yeah.
that's what they try to target.
Yeah, well, that's good, because that's, yeah. So how effective is the flu? Now, the shingles is 90%. Are we anywhere near 90% with the flu?
Not so much, but I think the key thing to look at that in patients who have comorbidities, which means patients who have diabetes, patients who have obesity, patients who have COPD or chronic lung disease, chronic heart disease, chronic kidney disease, chronic liver disease, in those it's effective up to 58%.
Right.
And 58% effective in preventing a hospitalization. And I think that could sometimes mean life versus
Yes,
death
yes,
for
that's
patients who
right,
have
that's
lung
right.
disease to develop severe pneumonia. So I think it does matter. For people who are healthy, it's about 37 to 40% effective. But again, it varies. I think in my personal experience, getting a flu shot will prevent severe infection. So it is always advisable to get it,
Right.
not only to protect us, but to protect around us, people
That's
who are
right.
vulnerable.
That's right.
So I'm sure in our families, there is someone who is elderly, who has one of these comorbid conditions.
That's right.
So we can prevent that.
Yeah, yeah. I need to get mine. I'll be honest, I haven't gotten mine yet. I'll get it tomorrow.
Never too late. It's never too late. Flu season is from October
Yes,
till March
that's
in
right.
northern hemisphere, and April till September in southern hemisphere. So I think it's never too late.
Right, that's
It's
right.
generally advisable to get it 2 weeks before the start of flu season, because
wow.
our body takes some time
To-
to make those protective chemicals. So
Yeah, yeah. And there's so many, not viruses, well, there are many viruses, but there's so many different vaccines now. Are there any others you would like to highlight that you think are really important? RSV or pneumonia, I guess that's probably a good one. That's still a kind of a high killer of people, isn't it?
Yeah. I think pneumonia, but I think lately we have found that the viral pneumonia is much more common than bacterial pneumonia. And many of these viruses, we don't have a vaccine except for flu
Right.
or maybe RSV.
Right.
But then I do want to highlight, in olden times and still in some cases currently, pneumococcus
Yes.
was a bacteria.
That's right.
And there is vaccines for that. Earlier we had Pneumovax,
Yep.
but lately we have Prevnar 20.
Yep.
And 20 stands for 20 different strains
Correct.
of the bacteria
Yes.
that it covers.
Yes.
So I think they should talk to their doctor and get this vaccine, and it is effective. And we have seen that patients not getting pneumococcus infections.
Right, right. Yeah, I always tell my folks, look, I'll say, I've had a pneumonia shot. Yeah, I know. You had the pneumococcal, and then you had the Prevnar 13. Now we're up to 20, so we got to do it again.
Update it, yeah.
Yeah, I think that's important to do, because pneumonia scares me worse than the flu, for me personally. I don't know why, it just does.
Yeah.
But,
No, I think if it's able to settle and cause bad pneumonia, it could be life-threatening.
That's right.
So,
that's right. So, do you have any tips on how to convince people to get immunizations when they don't want to? You've got all those,
Yeah.
you've got that section of population that says, nope, not for me.
yeah. I think, a topic like this could be sensitive. People have their belief systems.
That's right.
And I think it's very important to listen to them, to respect it, to
Right.
hear their side of the story on why, they want it or why they don't want it, and trying to understand it and using their understanding to make sure they're understanding it correctly and sharing the facts with them and making a shared decision.
Yeah. Yeah.
And I have been, from my experience, successful in some of these cases. Like I remember someone asking me, there is formalin in many of these vaccines as preservative. Why should I get it? And I said, you're right. That is very true. Formalin is used. But then I asked them, the formalin in an apple is much more than what you will find in a vaccine.
Really?
And, the person was amazed and he didn't know that. And he said, I did not know that. And we eat apples every day.
And we think we're doing great.
Yeah,
We think
and-
they're healthy, which they are, but,
Yes, and I think, so that was basically, he just waited to hear this and he agreed to get a flu shot.
okay.
So I think hearing them and then, providing them information and making a shared decision making.
Sure. That's good. I'll have to remember that. I kind of like, okay, if you don't want to, it's okay, but I probably need to be a little bit more diligent in my inquiry and,
Yeah.
like you said, listen a little bit more. So, all right, we're going to go into any more immunizations you want to highlight?
I think these are the common ones, flu, shingles, pneumonia shots, certainly, your tetanus shots every
yeah.
10 years.
Yeah.
I think these are the common ones.
Yeah.
And then COVID, I think, we had COVID shots and I think those were effective. So whatever CDC recommends, I think for the current season, they have updated the COVID shots and they are recommending 2 shots.
Oh, are they?
Yeah. So again, talk to your doctor and I would recommend getting it.
Yeah.
So.
We do all the immunizations at our office, but we've never done COVID. It's only done, I think, at the health department still and the pharmacies.
Yeah, they do offer Walgreens and CVS.
So those pharmacists are going to be more up on all this than I am because, we just.
It's changing also.
Right.
Every, 6 months or a year, there is a change in the virus and they update the vaccines.
Right. So, all right. So let's just go back to infectious disease. So it's an infection anywhere in your body, and you take care of that for them. So when do people get to the point where, or physicians get to the point they're saying, I don't know what to do anymore, I'm going to send this patient to infectious disease? What's that deciding factor there?
I think one is when infections are complicated. To give an example, say if someone has a very resistant bacteria.
Yes.
And commonly I get referrals for those because those require a high grade and stronger antibiotics. And so that's one. Second, it could be when the infection is spreading, like sepsis. Normally, we would recommend patients with suspected sepsis go to the hospital.
Right.
And then I see them
Right.
there.
Right.
And thirdly, if an infection is very deep, like infection is in the bone, and that requires longer duration of
Yeah.
antibiotics.
Yeah.
So then usually they send to the infectious disease doctor.
Excuse me, what's the success rate for osteomyelitis? Is it still pretty easily, well, I don't know that easily treated is the right word. It's treatable, put it
It's
that way.
curable, I would say curable, and I would say the answer to that, if we want to look at the cure rate of the infection, I would say it's 100%. Because if you know what bacteria is causing it, you're giving the right antibiotic for the right duration, you can cure it. But healing, many of the times these osteomyelitis, which is a bone infection, it's associated with diabetes,
Yes.
neuropathy, and located commonly in feet.
Yes.
And there are other factors also which are involved in the healing process. Blood flow, blood sugar control, whether the patient offloads his foot, which means, keep the foot away from, putting weight on it. So all those things, and protein intake, because you need good amount of protein
Yes.
in your diet to
Yes.
form new tissues. So I think all those factors affect the healing.
And that's another reason, I guess, why they do better in a hospital, because you've got that controlled environment, and you've got all the specialties you need. You've got a dietitian there to make sure that protein is up where it needs to be. Whereas if you go home, and the patient says, honey, I just want an apple for supper, she's going to say, okay, darling, instead of saying, no, where the dietitian would say, oh, no, you got to eat this.
Yeah, that's a good point. I think in hospital there is a a team-based approach. You're looking at the same thing from different angles. So certainly, I think it does make does leads to better outcome, because you're addressing the nutrition, as you said. If there's infection, the podiatrist or the surgeon can remove the infected bone. Infectious disease coming in with antibiotic. The hospitalist doctors, playing a role with controlling the blood sugars.
Right.
So I think it's a team approach,
Yeah.
and it leads to
Yeah.
the best outcomes.
That's right, because that osteomyelitis that word and sepsis are scary to me as a provider. It's like, oh, no, I don't want to see that. So we've only got a minute before we go into our next break. So let's just back up a little bit. And you talked briefly about herpes 1 and herpes 2. They're both a virus. So what's the difference between the two? What is 1 versus 2?
Earlier, historically, we used to say herpes 2 is below the waist, and herpes 1 is above the waist.
Okay.
And, they have been associated with genital illnesses, genital herpes. But I would add that many of, us have been exposed as kids to herpes viruses, from playing with each other or in daycare, and not necessarily, associated with sexual transmission. So
Right.
there are other ways of transmission, which is sharing items among kids or toddlers, and that can lead to transmission. And 95% of the population had herpes virus exposure since childhood. And the virus becomes, dormant, which means sleeps
Right,
again.
right.
And then when the immune system goes down, it comes up. And commonly we will see, oh, I have a cold sore.
Right,
When person is
right.
hospitalized for some other reason, they will develop cold sore. So that's classic, way when your body is stressed
Right,
due to hospitalization, the virus kind of, takes that advantage and wakes up. So in some patients, it can travel to the nervous system and cause the brain infection or encephalitis or meningitis.
Yeah, those are bad too, aren't they?
Yeah,
Anything in the brain, like you said.
is serious.
Yes.
Yeah.
All right, we're going to take our next break, and when we come back, we'll finish up talking about infectious disease. I think I've got more in my paper we can talk about, so don't go away. We'll be right back. Hang on.
Jay arrived at the emergency department with a hernia. He was in pain, scared, and unsure of what would happen next. That's when he met Dr. Clarice Monnier.
The way she conveyed, it was something that I could understand. She didn't talk over my head. She called me at home on her cell phone just to see how I was doing. They really treated me like family. I just can't say enough, and I wouldn't be hesitant to come back here.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the HERES Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mountain area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't arise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
America's Home Place is making your dream home more affordable with their November discount of up to $15,000 off the base model price. Whether you're seeking a cozy retreat or a spacious family home, we have the perfect floor plan to fit your lifestyle. And with endless options to customize, your new home is just waiting for your personal touch. Don't miss out on this amazing offer where style meets savings. Join us in celebrating our 1-year anniversary on November 8th from 4 to 6 p.m. to learn more.
All right, welcome back. This is Here's to Your Good Health. I'm Linda Preziosa. I'm here with Dr. Kanwar. He's an infectious disease at UNC Nash Health, right?
Yes.
We just talked about this. And I said, I have such a hard time because it used to be Nash General, and I worked there for 23 years. So in my old brain, it's still Nash General, but it was bought by UNC, I don't know, 3-4 years ago now. I don't know, I don't remember for sure. But anyway, I have a hard time saying UNC Nash Health. So please forgive me for those who have a aversion to me saying Nash General. So we're going to talk a little bit more. We're going to talk about some disease or some antibiotic resistant problems that we have. One is VRE and one is MRSA. So we'll talk about MRSA first.
Sure.
So what does MRSA mean? What is that, an acronym or?
Yeah, it's a common acronym, but it stands for methicillin, which is the name of an antibiotic, methicillin-resistant Staphylococcus aureus. So Staphylococcus aureus is a bacteria,
Right.
and it has become resistant to this penicillin, one of the penicillins. Methicillin was one of the penicillin, and it used to be called MRSA.
It's easier to say MRSA.
Yeah, rather than the long name,
Yeah.
methicillin-resistant Staph aureus.
And that's still, I mean, that was really prevalent when I worked at the hospital.
Yeah. Yes, I think MRSA has now become prevalent both in the communities and certainly it's a hospital-associated infection as
Right,
well.
right.
But interestingly, I want to point out some history.
Yes, yes.
There was a strain of MRSA called the strain 300.
Okay.
And I think in California, there were these wrestlers and football players where we found that they were having increased infections. And I think when infectious disease and epidemiologists studied that, they found that, these sports involve physical contact. You are grabbing, each other or running and close contact. And that is one way of spreading MRSA. So they found a strain 300 which was implicated in an outbreak of skin soft tissue infections among athletes. So it has become prevalent in the communities. I would say about 10 to 20% of the population has it in their nose. That's basically where it lives. From the nose, it can get to the hands, and from the hands, it can get to the rest of the body.
Right, you scratch yourself.
Yeah. The good thing is, if you find it, it can be eradicated by using a cream called mipiracin and then using Hibiclins, which is a common antiseptic soap, for 5 days.
Really?
Yeah.
Huh.
So that's a common strategy we use to get rid of MRSA, not only from the nose, but rest of the body. So, and then MRSA is pretty hardy. It can survive on like a tabletop or any surface for months.
Oh, great.
So,
Wonderful.
so if we have patients with MRSA infections, we usually recommend that they also, when they're cleaning, the Hibiclin soap and then using the cream for the nose, they also clean their house high-touch surfaces once with bleach wipes and laundry their clothes under high-temperature dryer setting. And the whole idea is to prevent MRSA coming back from the surroundings back to the patient.
I remember when I was in training to be a nurse practitioner, they were doing bleach baths because there was so much MRSA on the skin.
Yeah.
Are they still doing that, or that?
I think it's a very cost-effective way of doing it. So you use a certain concentration of bleach,
Right.
and you dilute it, so that it's not, hurting the skin. In a very dilute solution of the bleach, you can apply it or bathe in it, and that will get rid of MRSA from the skin.
Yeah, I guess that would help with cleaning its surfaces too.
Surfaces too, yep.
Especially like kitchen counters and things, where everybody's sitting around, and I've got a big, long, 9-foot long bar that it's got bar stools and everything, so everything is done on that bar, so it gets pretty nasty, I'm sure, so bleach water would be good for that.
Yeah,
So. And then there's VRE, I remember that but I don't remember anything else other about it, so.
So VRE stands for vancomycin-resistant enterococcus.
That's right.
Enterococcus is a common bacteria you will find in the urine and feces. So patients who get antibiotics, especially vancomycin, the enterococcus becomes resistant, and lately we have found that VRE, it can be transmitted from one individual to the other, commonly seen in the hospitals, but it has become so prevalent that some hospitals will isolate patients for VRE, some would not.
Oh, yeah, that's right, they did. Are they still isolating for MRSA?
Yes.
Both of them?
Yes, for MRSA and VRE, but the difference there is that MRSA is more virulent,
Okay,
more dangerous,
Right.
Can cause really bad infections compared to VRE.
okay, interesting. So, getting back to those wrestlers, do you think that the body fluid contact they had when they were wrestling had something to do with the transmission as well?
I think so. What they found was that someone was carrying MRSA or had an infection, and they still had it on their skin, but when they came in contact with others, they could transmit it through skin contact to the other person. Not only skin contact, if they were in the locker room and they were, touching the
Right,
same
right.
set of surfaces,
Yes.
that could have also led to the transmission.
Yeah, interesting, it's interesting. So, let's see, we were going to talk about something else. What was it? I don't remember, I didn't highlight it. Oh, so do you have an office that I can send my patients to, or you work out of the hospital, or?
Yeah, so I work with at UNC Nash, and I also have a clinic there, same campus, and also see patients at the hospital.
Okay. I think a good friend of mine works for you, Sandra Terry.
Yeah.
Yeah,
she's
she and I worked in
excellent.
the ER together.
Yeah.
I've known her a long time.
Yeah.
Yeah, we've been good friends for a
Sandra.
long time. Yep. Hi, Sandra, you should be watching. So, well, what would be the most best thing for people to do to stay as healthy and clean and, wash their hands? What do we need to do to make sure that we don't ever have to see you?
So, very good question. That will put me out of business. So,
I don't think you're going to go out of business.
yeah, no, I think I'm happy to go that way. If people are healthy, I'm happy to do that. But I think I would like to answer that question by using a triangle. So, so for an infection to happen, there are three things. You need a host.
Yes.
You need an agent, and you need the environment through which that host is transmitted from one person to the other. And we can expand it to form a chain of infection. So if we break that chain of infection, infection won't be transmitted from the bacteria to the host, which is us or humans.
Right.
And common things which will break that one is hand hygiene. So if we use hand hygiene, for example, we are going to a grocery store, we use a cart, and we can pick up bacteria. So using hand hygiene there, hand hygiene when we are visiting someone in the hospital. In the hospital, when we are seeing a patient, they may have their own set of bacteria. Some of them may be bad, and it may not affect us directly, but we may get colonized, which means they can get on our skin, on our body, and use that to be transmitted to the others. So hand hygiene will break that chain of infection, because if you touch something and then you use alcohol, it's going to instantly kill the bacteria. So that's one. Second is using a mask. So if someone has an infection like flu or cough or sneezing or flu-like symptoms, if we wear a mask, we are not only preventing the spread to the others, but also if someone is sick in our vicinity, like in a family or friends or at work, if other people also wear a mask, that will protect them. So common examples how we can prevent infections. And then certainly getting vaccinations is a low-hanging fruit. We discussed about shingles, 90% effective. And then I think eating healthy, if someone has diabetes, keeping it under control. If someone smokes, quitting smoking. If someone is injecting drugs, quitting that. So I think those risk behaviors, if we modify them, that could prevent infections.
Yeah. I don't know if this is even all that pertinent, but I just thought of it. There's so much vaping now, and some of the studies have shown that vaping is even more serious than smoking itself. Have you seen any infections in the lungs due to vaping?
I think one of the infections, I have not seen personally, but I have read about it. So we have seen outbreaks of fungal infections due to the contaminated oil that they use in vaping, and that could lead to that. And I agree that it is more bad than smoking also, and I think a few years ago we saw an increase or uptick in cases where vaping-induced lung injury was becoming more common.
Yeah,
So-
yeah, and it's so popular amongst the young ones, and my youngest son vapes and drives me crazy, but he's a grown man. I can't, Mama can't say anything at this point in his life. But,
Sure.
And then I've got a friend whose daughter vapes, and she had a lot of problems, and she was, of course, she was smoking some weed at the same time, but she had a lot of pseudo seizures, and she went to the ER multiple times in Greensboro for this. And, the doctor just finally sat down and said, look, you've got to quit this. The vaping is terrible, and you're smoking marijuana with it. You're killing yourself.
Yeah.
But she's like 24, We're all invincible at 24. We're never going to die at 24. At least that's the way I was. But I don't know. I don't like either one. I don't like ingesting anything in my body that doesn't belong there. But
Yeah.
it's, it's important to. All I drink is coffee and water, and I probably drink way too much coffee.
I could use some tea there, some green tea there.
Yes, I should.
Antioxidants.
You're exactly right, and I should go home and drink some of that and settle me down. I'm kind of wired tonight.
Yeah.
So green tea would be good, yeah. All right, do you have anything else you want to share about the vaccines, or when we should get them, how often we should get them, why we should get them, or anything on your mind about highlighting what we talked about this evening?
Yeah, no, I'm going to add one more thing about
course.
penicillins.
Okay.
So penicillins are very useful antibiotics, and 10% of the U.S. population has a penicillin allergy in their chart.
10%, yeah.
Yeah.
I've got one.
Yeah. So, and I do penicillin allergy testing.
Do you?
Yeah. And I had really good success, and I think this is nationally, many people have done this. And 95% of people who think they're penicillin allergic are not allergic
Right.
when you test them.
Right.
And reason being is many of these allergies happened when patients were kids.
Yep,
And-
that's when mine did.
And the mechanism of penicillin allergy is IgE antibodies, which are a specific set of chemicals which are formed when the reaction happened. But the good thing is that 10 years after the reaction, your body has forgotten, and those
Oh,
chemicals
okay.
are already out of your system.
So I can have penicillin.
Yeah. So, but I think the safer way to get introduced to do penicillin would be to do penicillin allergy testing. And the way I do it in my clinic or at the hospital is that we give them a very small dose, like 50 milligrams. The usual dose is 500 milligrams, so it is like 1/10 of the regular dose. We watch the patient for 30 minutes, and if they do just fine, we give the other dose, watch them for an hour, and if they have no reaction, we remove the allergy from the chart. And personally, I have removed allergies from hundreds of patients, and
Okay, yeah.
95 to 98% were negative.
And that's a good thing because it's a good drug, it's an effective drug, and it's an inexpensive drug.
Yes, and also there was this association when patients with penicillin allergies, they were given second-line antibiotics like vancomycin. There was a longer length of stay, about $64 million. Said one of the studies where they looked at, I think, 400,000 patients, $64 million extra healthcare cost was spent to keep those patients in the hospital and to give those second-line antibiotics.
Wow.
There was a higher incidence for MRSA, VRE, and C. diff, which is another bacteria
Oh,
which
yeah.
can happen when you're exposed to antibiotics. So penicillin allergy testing, I think, is a great gift from doctors to their patients. For the rest of their lives, they can receive penicillins if they are not allergic. And that could impact the quality of their care
Wow.
and outcomes.
So all I have to do is refer my patient to you for penicillin allergy testing?
Yeah, you could talk to them about it, and if they're interested, so I set up an appointment, I talk to them, this is how we do it, and if they are interested, then we, schedule them for testing.
Okay. And is it covered by insurance?
So Medicare covers, part of it, and private insurance also covers part of it.
Okay.
But I think if we look at the whole picture, it has so much benefits because
Oh,
for
yeah.
the rest of their life, they can receive penicillins.
Right.
So,
Yeah. Fortunately for me, I'm pretty healthy. I can't tell you the last time I took an antibiotic, and that's a good thing. I don't need an antibiotic.
yeah, no.
We don't want those if we don't have to have them.
Yes.
Well, thank you so much. It's so great for you to come.
Thank you for having
It's
me,
really nice to
and-
meet you.
Yep.
Tell Sandra when you see her tomorrow that I said hi.
I will.
All right. It's time for us to go. Thanks so much for watching, and we'll see you next week with more of Here's to Your Good Health. Good night.
Good night.